Today we are joined by Christina Gerde from Sweden, a passionate advocate working with the PALEMA diagnosed group on pancreatic cancer. Christina brings a valuable dual perspective, both as a professional with a strong background in business analysis and project management, and as a patient and survivor who's deeply engaged in improving patient outcomes. Christina, thank you so much for joining us today. Could you briefly introduce yourself, your name, where you're from, and a bit about your background?
Thank you, Erika, and thanks for having me. And you have already said a bit, but I can give my own words on it. So I'm Christina, a Swedish pancreatic cancer person. And thank you also for saying a survivor. That's a word, that you really don't want to use because this disease is so very, very awful and will hit you maybe many times, but at the moment, and I hope it stays so, I'm without evidence of cancer. So I have some energy to work with the questions that are related to pancreatic cancer, and there are a lot, since this disease and treatments they're so behind. So I have engaged myself for others and for myself to see what's possible to do to improve the situation. There is room for improvement.
Thank you so much. Thank you for being here and for your availability. We truly appreciate it. And with we, I mean the SHIELD project. So you and PALEMA are part of the SHIELD project. Can you explain a little bit what led you to participate to the project and how do you share its mission? The SHIELD project aims to decrease the high mortality rate that we have in Europe right now connected to the pancreatic cancer.
To begin with, the statistics with pancreatic cancer is awful. I mean, the numbers in Sweden, after 10 years, only 4% are still alive if they have gotten the diagnosed pancreatic cancer. 4%. After 5 years, it's 7%. It's really, really bad. So we need to do everything that's possible to help in this situation. An early detection, which is the mission of SHIELD, is very, very important. And I'm thinking about early detection in a very general way. So the more we can find, the better it is, and we can get deeper into that. But I think here there is lots of room for improvement. So when I got the question, I didn't know so much about SHIELD, but it's all very valuable for a patient organization to be part of something also as early as possible to improve the situation. And early detection is important.
We mentioned before that you are a survivor of pancreatic cancer. Can you tell us a little bit more about your personal experience?
I have never ever thought about cancer in my life. I'm a very healthy person and a good lifestyle and all of that. So I had some strange, no, not strange actually, just some very vague symptoms. Not symptoms either, it's just very common things like, a little bit of reflux, a stress situation, drinking a lot of coffee. Not a big deal. That's what people around me said, but I didn't recognize it as something that was actually me. So I did follow up on it, luckily. So there was a little room of opportunity to catch it before it got too late, and I was lucky there. So when it was identified, everything went very fast. I was very happy with the support I got from the Swedish healthcare system. It was all standard, so there was nothing outside the limits for me. Surgery, there's a very, very big surgery that you do, the Whipple procedure, and then I had chemo for 6 months. Very, very challenging chemo, but I did fine in all of this. And I've always, during this time been asking the question, is there more to do? Because even after this very heavy treatment, the chance for survival is low. So what else is there to do? That has been the question I've been working with, and I think in my case, for what Shield can bring for me and many others, that is early detection in terms of reoccurrence. We're going to talk more about that, but that is also a very important part. I'm a high risk. I'm a very high risk individual. Many of us are there. Early detection of recurrence could help. So that's a part that I'm working on. Then early detection for people in general out there that aren't aware, as I was, say it's now 3 years ago. That is also a very important part to improve the survival numbers. What we know from statistics after doing some analysis is that in the Swedish healthcare system, at the first point of contact, those early symptoms are missed.
The SHIELD project, it's very important because it's about early detection. And what we are working on is a blood-based screening test for pancreatic cancer. So what are your thoughts on this initiative, on the blood test specifically?
Blood test, that's perfect. As a blood test is so good, because if we can find a blood test that could help out to identify pancreatic cancer early, that's a tremendous help, because it's not so invasive, and it's easy to conduct. The challenge here is to find a good, reliable blood test. In my vision, thinking about it, a liquid biopsy blood that is able to identify inherited pancreatic cancer, but also the very big portion of the problem, other genes that are mutated during your lifespan, that would help tremendously. So that's a challenge, to find something, and I really wish that SHIELD could be a good help in this direction, to be able to identify inherited, but also the 90% of the other situations where actually the KRAS gene has mutated. But that's something that you gain during your lifetime. That's the major part. The inherited part is also very important. Altogether, it's 100%. 90% is the part that exactly happen during your lifetime.
I think it's really important for also people that do not know a lot about pancreatic cancer, and can have a little bit of an overview of the available resources that can fight it today. So we talked about the blood test screening that SHIELD is working on. I think the key here is going to be accessibility, right? So how are we going to reach out to high-risk individuals to allow them to access the screening? Do you have a comment on this?
That's a very good question, and I have been thinking about it. I've also been talking to friends about it. Like, what do you think? How can this information go through? And I think, and also talk to other people in PALEMA, so it's not just my thoughts. I mean, there needs to be several channels for this. There needs to be general information, public information. I think it would be nice if there is a site where you can go in and have a dialogue online. I also, and maybe chat about your own situation. I think it would be very important. First point of contact, they have the knowledge, they need to have the knowledge, the physicians need to know about it. They should actually ask people coming in about their situation and suggest to do this test to see if they should be part of a surveillance program or not. So I think that's a big challenge here. There needs to be many ways to come out with information and then get responses. It should be easy to them to take this blood test.
The blood test is for person at high risk. That's the definition. So that's the target group. I think it's not so easy to understand if you're a person at risk or not, if you would qualify for this test or not. How would you define a person at risk, since you're also working for the PALEMA Association, so you're very much exposed to this, and also you are as well a pancreatic cancer survivor?
Yeah, I think there are several high-risk parameters. I mean, first, if you have the inherited gene, if you have family members, close relatives that have cancer, have had cancer, have passed from it, pancreatic cancer especially. If you have just one close relative, I think you are at some kind of high risk. So we need to be a little broader there than what the situation is currently. Better safe than sorry. Diabetes, if you have problems there with sugar levels, and then I actually think that if you have some kind of strange systems, as we spoke about, some losing weight, pain in the belly area, tummy area, this light coughing, maybe strange things, reflux, strange things, that could be a high risk situation. So if there is a blood test, just why not do it early, because then you can catch people earlier than today. And then the people that are without evidence of disease but have already been diagnosed but are fine, then the screening today with computer CT and the PET CT and MRI and all of those, they catch it sometimes too late. I mean, a blood test can see something in the blood earlier before it's been seen on the screen. So that would also, and that's definitely a high risk situation.
You mentioned using the test for a recurrence monitoring. So you mentioned if you already have pancreatic cancer, then the blood test could help you to see if the disease is back. So what is important and what would you expect from such use?
I mean, I think if the situation for these people are really bad. I mean, if they get a recurrence, there are actually very few treatments. It's almost a death sentence today to get a recurrence. But if a blood test could identify it earlier than the screening I talked about that is standard today, then there is an opportunity to do some life-saving treatment, and that could save life. So that's the easy answer. That could make a difference.
Thank you, Christina, for sharing. Is there anything you wish that researchers and developers better understood about patients? And maybe you have like something personal to share, but also like in general since you're so involved with patients associations, what is your experience?
Well, I think it's very important actually to involve patients in stage where we can make a difference. I mean, we can do more than just review documents and look for the small things. We'd like to be there also to shape and form the projects and really have a voice on the same level as others in the project. We don't want to be there just as, it could be nice to say we have patients' involvement, but it needs to be real. So listen to us, bring us in early. Actually, also pay us. A Shield is doing very well here, but often when we are working on our spare time, and there needs to be a balance somehow, because I think we are, as our chairman always says, we are the wise, and it's done for us. We are not biased, and we have no careers. We just want to survive. So and we want something back also from what we do. So, for instance, if I give my blood to Shield, I'd like to have the result back.
If you would have to say, what does success look like for a project like Shield? So to involve patients, to have patients at the heart of what we do, and that's definitely our mission. But if you would see it from the patient perspective, of course, I would suggest that the success for a project like this is to actually be effective and to reduce the mortality rate for this terrible disease. But do you have anything to add on this?
Yeah, I actually think it would be really nice to have clear goals and measurements on success. And I mean, if to raise the survival rate in Europe from what it is today to, I think you have the goal of 35% or so. That's very good, because that's a big, huge difference, and that I mean that is so for every country. I of course want Sweden to be part of that score. I mean, that's it, to work on that, and to improve the survival rates to 35%. That would actually mean a broader scope, to look at also the 90% that are not having an inherited mutation. For me, that would be very valuable. I also think, I mean, if the result from Shield is out in the guidelines, the Shield process, the blood tests are stated in the European guidelines and then in the national guidelines, so it actually happens in clinic. It needs to happen to actually give result.
So just closing now, I would like to ask you a few words about PALEMA. What's your role in Sweden and in the Shield project?
Thanks for asking about that. Yeah, PALEMA, that is the one patient organization in Sweden for upper GI. So pancreatic cancer is one of our diagnoses, and actually the biggest one, with most members. But we also cover stomach cancer, bile duct cancer, esophagus cancer, liver cancer. So we have 5 diagnoses that we're working with, and we're a really small organization just because we die. We don't have the energy. There are actually we have about 1,100 members for these 5 diagnoses, but people are dying, and we're getting new people coming in since the mortality numbers are so high. We stand for 20% of the deaths. So PALEMA is really having a fight to do, and yeah, we are a non-profitable organization, and we try to collaborate as much as we can, and yeah, we are 10 years old. So 10 years ago there wasn't an organization, but yeah, we had a celebration of that 10 years now.
That's nice. That's nice. I think well, the only comment we can have to end this interview is that you're not alone. Like we have a consortium that works on the Shield project. We are almost 30 members, and we will definitely support PALEMA and our shared mission. So let's see where this project will bring us. So Christina, thank you so much. Thank you a lot for your time, for being here, and for being an ambassador of PALEMA, of SHIELD, and of our mission against pancreatic cancer. So thank you very much.
Thank you. And I really appreciate what you're doing in SHIELD, and I like the collaboration, and that's the way to get stronger.
Thank you.